Injuries to the head, neck, and back are extremely serious and can lead to disability or death. They must be handled with great care using specialized rescue skills.
Fortunately, head, neck, and back injuries are rare, but they can happen anywhere in your facility, and you need to be prepared. These injuries can occur from falls, collisions, and head-first entries into shallow water. You should always suspect a possible head, neck, or back injury in the following situations. Any injury caused by entry into shallow water. Injury as a result of a fall greater than standing height. Injury involving a diving board, water slide, or a person entering water from a height, such as an embankment, cliff, or tower. A person holding his or her neck or head and complaining of pain. A person complaining of neck or back pain, tingling in the extremities, or weakness. Someone who appears to be frail or over 65 years of age. A person who is not fully alert. Someone who appears to be intoxicated. Or injury from a force which impacts the head.
You should also look for signs and symptoms that could indicate a possible head, neck, or back injury. These include changes in level of consciousness, severe pain or pressure in the head, neck, or back, loss of balance, partial or complete loss of movement of any body area, tingling or loss of sensation in the hands, fingers, feet, or toes, persistent headache, unusual bumps, bruises, or depressions on the head, neck, or back, seizures, blood or other fluids in the ears or nose, heavy external bleeding of the head, neck, or back, impaired breathing or vision as a result of injury, nausea or vomiting, or bruising of the head, especially around the eyes and behind the ears.
If you suspect that someone has had a head, neck, or back injury on land, act immediately and carefully. Activate the facility's EAP and follow the general procedures for injury or sudden illness on land. Size up the scene. Perform an initial assessment. Summon EMS personnel. Perform a secondary assessment. Use appropriate personal protective equipment such as disposable gloves and breathing barriers.
If you suspect that a patron has a head, neck, or back injury, you must use rescue skills developed for these types of injuries. They're designed to minimize movement of the victim.
Minimizing movement is very important because even a little movement could cause further injury. So if you suspect a head, neck, or back injury, tell the victim not to shake or nod the head and simply answer yes or no to your questions.
Let's start by watching how to stabilize a head, neck, or back injury if the victim is on land and lying down. Kneel behind the victim's head and place one hand on each side of the head to minimize movement. Stay in this position and watch and listen for changes in consciousness or breathing until EMS personnel arrive and take over.
If the victim is in a sitting position, face the victim and place one hand on each side of her head to minimize movement. Stay in this position and watch and listen for changes in consciousness or breathing until EMS personnel arrive and take over.
If the victim is standing, place one hand on each side of his head to provide inline stabilization. Do not have the victim sit or lie down. If he becomes unstable, complains of dizziness, has a potential life-threatening condition, or begins to lose consciousness, slowly lower him to the ground with the assistance of other lifeguards. Try to maintain inline stabilization while the victim is being lowered.
If the victim's condition is stable and your facility requires the victim to be secured to a backboard, get help from 2 other lifeguards and follow these steps. Lifeguard 1 approaches the victim from the front and provides inline stabilization by placing one hand on each side of the head. Lifeguards 2 and 3 position the backboard against the victim's back so that it is centered behind the victim. They must be careful not to cause any movement to the inline stabilization. While Lifeguard 3 holds the backboard, Lifeguard 2 secures the victim's body to the board by placing and securing straps across the chest and under the armpits and over the hips and thighs. This helps prevent the victim from sliding on the backboard when it is lowered. Lifeguard 2 rechecks the straps to be sure that they are secure. Lifeguard 2 then secures the victim's head to the backboard using a head immobilizer and strap across the victim's forehead. Lifeguards 2 and 3 place their inside hands underneath the victim's armpits and grasp the backboard through the handholds that are at the victim's armpit level or higher. When the victim is secured to the board, Lifeguard 1 moves to the back and grasps the top of the backboard. Lifeguard 1 tells the victim that they are going to lower him to the ground. Lifeguard 1 then gives a signal, and all 3 lifeguards slowly and gently lower the victim. Lifeguards 2 and 3 should walk forward and bend at the knees to avoid injuring their own backs.